to All Creatures Animal Hospital puppy class. My name is Gabby. I'm one of the vet assistants there, and I am doing a video today on spaying and neutering. So just kind of wanted to talk about everything as far as questions that are typically asked when it comes to spay and neuter, when's the right time. So I'll go through some of that information. Feel free to comment if you have any questions or if there's something that I say that's confusing or you need me to address, but hopefully I'll kind of help get all those questions answered so you know exactly why we recommend doing it, and kind of all the behavior stuff that comes with it by not doing it, the risks of not spaying and neutering, and just why it's so important. So we'll talk about the typical age of spaying and neutering is recommended between 6 and 9 months of age. A lot of people, question, oh, is that, too young to do it? Well, at that age, there's been studies that show that it's enough hormones in your baby's system that is enough to help with all the growing and doesn't hinder their growth at all, or any kind of developmental issues. But it's not too many hormones that can cause a greater risk down the future. So typically with females, if they're not spayed, they can have a higher risk for ovarian cancer. I apologize, my cat just decided to join. So for females, there's a greater risk of having ovarian cancer, mammary cancer. They obviously will go into a heat cycle that happens twice a year, so there is some discharge that comes with that, some behavior issues. They can learn to mark just as males can, so those are some things that come along with it, as well as if they do have their ovaries at a later time in life, they can get infections in their uterus. By having their ovaries in their uterus, they can get infections that cause what's called a pyometra, which even, from personal experience, I had a kitten, the one that just decided to jump and join in on the video. She wasn't even 6 months at the time, and she had gotten a pyometra, an infection in her uterus, and that's super uncommon at a young age. But luckily she was at the perfect age where we could spay her a little early, and it causes an infection throughout the body and a lot of discharge, and it's just not something that you ever want to see your baby go through. And even at an older age, they can still get that infection, and it just causes a lot of risk. So if you get your baby spayed between the 6 and 9 month mark, you can eliminate that in the future and prevent a lot of things that your baby would have to go through if you didn't do that. And then as far as males, by not neutering them, there's a greater risk for testicular cancer, prostate cancer. There's a lot of behavior effects, so they can, become more aggressive with all the hormones, so being more territorial, they'll start to mark. That marking can not just be outside, that can come inside. We had a tech who had a Chihuahua, and she waited because she was at the time thinking of breeding, and she decided to hold off on neutering, and he learned the trait of being able to mark, and that went from outside to coming inside. And that's something that's really hard to untrain. Once they learn how to mark and kind of make their statement that this is theirs, they'll start to do that in the furniture and different parts of the house, and that's a real pain in the butt because you may have to resort to doing diapers or having to deal with those accidents and cleaning up all the time. So if you can eliminate them from learning that behavior, most males, if you do neuter in between that 6 to 9 month mark, and especially closer to that 6 month mark, you can prevent them from learning that, and they'll always squat, almost like a female squats to urinate, versus learning to hike their leg, which is also, good because, again, then they're not closer to that habit of learning how to mark on things as they go along. But also the aggression. Males can sense females in heat for, miles away. So even though your dog may be in your yard and, there might not be any female dogs close to you, but if there is a female dog in that vicinity within those miles that is in heat and he happens to catch a whiff of that, a lot of dogs happen to break out during that time. You know, when it is that heat season, will escape from yards, trying to find that female that's in heat, because that's just instinct, and that can cause a lot of issues with a dog getting lost, you know, getting hurt when they're not at home. So super important. Not saying that, you know, if you are looking on the path of breeding, you know, we are here to help you and to guide you, and that is not something, we don't judge you for that. But you know, it's just a lot of work that goes into the breeding, and if that's something you want to do, you know, we're here to help you, to guide you. When it comes to breeding, you know, if you have the female, it's, you know, a lot of work as far as, you know, it's costly, and you know, you're taking on most of the responsibility by, you know, having, you know, the puppies with you. And when you go through the process after they're born, they have to be dewormed every couple of weeks, they have to be vaccinated, have exams done. So there's a lot more, you know, to it when it comes to breeding. And then as far as the male, you know, they have to be there and kind of help. You're in a, you know, a partnership if you're doing it with somebody else that you found a female to breed with, or, you know, if you're have both the male and the female. So it's a lot of finances. You know, it doesn't just happen after the first, you know, litter that you're making your money back, if you're looking to try to make money. So it's just, you know, a lot to consider, and we're here to help you. So, but we do recommend it, you know, doing the spay and neuter at 6 to 9 months. Even if you're females, you know, sometimes we do have females that go into heat right at 6 months. And that's not uncommon. You know, it just depends on the time of year. It's typically around spring and fall that the dogs go into heat. And it's typically almost a month process. And prior to, you know, they're in heat prior to you actually seeing the discharge that comes out. That you typically notice as far as like the spotting and things like that. So it's just super important that when your dog is not spayed, that they're not around any unaltered dogs that are not neutered, and just being really mindful of where they are, so that they can't get pregnant if you're not planning on that, or you're just waiting for whatever reason it may be. So just be very mindful of that. And they do have puppy diapers and things like that that can help kind of with that area as far as the discharge and things like that. So, but at 6 months of age, you know, if they do go into heat, that doesn't mean that they can't be spayed. You know, it just sometimes requires a little bit more time under anesthesia and a little bit bigger of an incision. But that's something that we can still do. So if they happen to go into heat and you're planning maybe the next week to get them spayed, you know, we can always up that earlier and be able to get that taken care of, which will stop the heat cycle, obviously. So those are really the important reasons why we recommend spaying and neutering. It's not just because we want to spay and neuter dogs. You know, there are health risks for having all those hormones. You know, their body is working overtime with having those hormones in their system to be ready to breed. And if they're not being bred, and those hormones aren't being used, you know, it just makes their body, what's the word that I'm looking for? It takes some of the lifespan away from these guys. So their body is working way harder than it should for no reason, essentially. And, you know, by spaying and neutering them early, in addition to, you know, taking those risks as far as like health and the cancers and stuff that can come along with it, it also prolongs their lifespan too, because their body isn't having to work overtime producing all those hormones for no reason. So super important. And, you know, like I said, we're here to guide you. We're here to help you. If you have questions when it comes to breeding, or more questions about the spay and neuter, you're more than welcome to comment on this post, to message us, to call the clinic. And, you know, we're here to help you and, you know, answer any questions that you may have. But in regards to the spay and neuter, So recommending that at the 6 to 9 month mark. If you decide that you want to wait a little after that, that's fine. It just increases the risk for having some of those side effects with the cancers and stuff. But at least if you do it at an earlier age, that's definitely better than not doing it at all. Um, I've had questions, about large breed dogs. A lot of the time it says on the internet that they should wait until they're 18 months of age and they're full grown. I've never had any kind of scientific proof that there is any issues with dogs, um, you know, not growing or having any kind of issues by being neutered or spayed at a young age, or at the 6 to 9 months age, versus the 18 months. There's research that shows that it's still better overall to do it at the 6 to 9 months of age. But if you choose to wait until the 18 months, that's fine. I had a Great Dane that I neutered at 6 months, and he grew to be healthy and 180 pounds. So it didn't stop his growth at all by neutering him at an early age. It just really kept his demeanor very sweet. He didn't have all that testosterone in his body, and I just think it was great overall. It didn't affect his health in any way, shape, or form. But some people really prefer to wait, and that's fine too, if you prefer, but we've not had any research that shows that there's any issues with, neutering or spaying earlier, than the 6 to 9 months or the 18 months of age. So that's perfectly fine to do at an early age. But like I said, we're here to support. So if there's any reason that you prefer to wait or you just like to because that makes you feel better, we're here to do that. So that is not an issue. We want to work with you and do what you feel is best for your baby as well. But again, so with large breeds, it's still the same recommendation. Cats, it's the same, 6 to 9 months of age. When it comes to exotics, which I can do like another little blurb on for our exotic parents, that can change as far as age, but when it comes to dogs and cats, it's between 6 to 9 months. With our procedure, if you've looked into getting your spay and neuter done at our clinic, or you've price shopped around, because I know a lot of people do, and unfortunately we're in really trying times right now with everything going on in the world and the pandemic. But the one thing I can say is there is a lot of value behind why our spay and neuter is more expensive than maybe an alternative place or spay and neuter clinic. And the reason for that is we do require blood work that's done anywhere from at least 3 days prior to the procedure up to 30 days prior to the procedure. And it's a full panel blood work that checks all the liver values and functions of your organs. So same as for us. Before I had a major procedure last year, or any procedure, I'm getting blood work done to make sure that my organ function is good and everything is, matching up to be able to handle the anesthesia properly. So we do require that full panel blood work, and we send it, to an outside lab. But we're getting all these values, your liver values, your pancreatic values, making sure that there's, no infection or white blood cell count is increased. So we want to make sure that we're doing all the preventatives that we can as far as making sure that the procedure is a smooth, quick, and easy one. We also have a licensed veterinary technician or veterinary nurse that monitors your baby from the whole procedure from start to finish. It's typically not a very long procedure, it just kind of depends on the patient, but it's anywhere from 30 to 45 minutes where they're under anesthesia, and then it takes them some time in the recovery, just like it would for us. And then also our spay and neuter packages include, us doing an electrocardiogram to monitor heart function prior to the procedure to make sure that everything is functioning in that aspect. There's nothing that's being missed. And then also we place an IV catheter, so just kind of like the IV that we get in the hospital or when we have a procedure, we do the same thing for these babies to make sure that we have a port of access for giving the anesthesia. or if we need to give fluids or anything during the procedure, we have that set. And then they also get the complimentary nail trim while they're under anesthesia, which is great because you can get those nails nice and short while they're sleeping. And then we express anal glands. So there's, and then a pain medication that they get after. So there's a lot that's included in our packages. And sometimes with the spay and neuter clinics, it's just a very quick procedure. They don't typically do blood work because they assume that all, young patients are healthy and there is no concern. But we do a lot of extra preventatives to make sure that our babies are safe. And like I said, they have a very smooth procedure. We have procedures available or appointment times available 6 out of 7 days of the week to make sure that, we have availability for you to be able to take care of your babies. And they're typically, they're drop-off procedures. So you drop off in the morning time to let them hang out with us so we can do some of the pre-surgical stuff to get them ready for the procedure. Surgeries are done throughout the day, and then we give you a call, let you know that your baby is awake, and we set a discharge time, and you're able to take them home that day. When it comes to procedures, it's amazing how resilient these guys are. I had an abdominal surgery last year, and it took me, months to recover, but like 3 weeks of like solid rest before I really felt comfortable to function almost, somewhat normally, to walk around and do stuff on my own. And with females, when they get spayed, it's a small abdominal incision. It's probably like about that big. Pending, sometimes it's a little bigger if they're in heat because everything's kind of swollen. But it's a small incision for females, very small incision for males. And they're typically back to normal later on that day, like right after the procedure. Some of them, it takes a little longer to wake up, just like us. But most of them are ready to go, ready to start running around. So the biggest task for you is keeping them calm when they're at home. Recovery is typically 10 to 14 days. So you have 10 to 14 days where they do have to keep that EAT collar on, that beautiful plastic collar, to make sure that they don't get to their incision, they don't lick it, irritate it, and can cause an infection or take those sutures out. Sometimes there's suture there that does need to be removed in that 10 to 14 day time frame, and sometimes it's just glue suture, and we just recommend rechecking that 10 to 14 days after to make sure that everything's healed properly. But they're so resilient. It's very, they are typically right back at it later that day or the next day, eating fine. I think they're just more miserable with the cone and having to stay still and not be back to their puppy energy. And there's things that we can give in addition if you feel like your baby is just too crazy and you can't keep them calm. We can give you some, sedatives to kind of help and relax them to get through that recovery. But I think it's more painful for us than it is for them, to be honest. It's just amazing how quick that they recover and they're kind of back to it. So, there is a lot of value in our spay and neuter packages. We do offer wellness plans that kind of help break up that cost for that. And then, it's great to look into insurances. I know I've talked about it on previous videos. Getting a pet insurance with a wellness package is great because even though with pet insurance, again, you have to pay up front for that and then get reimbursed, you at least can get that money back. So I think it's a great thing to have, even if you don't expect obviously anything to happen. It's better to be safe than sorry and to have it in place. So look into getting the insurance. Nationwide is a great brand. Trupanion is great, but that's also more for illness versus wellness. But it's always good to have illness insurance as well. But super important, to get the spay and neuter done. And we send you reminders, to kind of reach out. And if you have any questions, like I said, comment, let us know, message us, and we can go over, more stuff. Some people even choose to board for the spay and neuter, maybe line it up if you're planning on going on a trip soon. and have them have the procedure done with us, and then have the first few days with us with recovering, and then they go home and can kind of finish up at home with you guys, which is great too. So, we're here to help in any way that we can to make it easy. But these guys are resilient, and they're just ready to go no matter what they go through. So it's amazing. I wish that we had that ability, just like they do. And then also too, you can split everything up. So do the blood work, earlier in the month, and then, do the spay or the neuter towards the end of the month. That can help as far as financial costs too. When they are getting spayed and neutered, we do look at a lot of the baby's teeth to make sure all their puppy teeth have come out. So not so much for the large breeds, they all lose their teeth, don't really have any issues, but with our smaller breeds like our Yorkies, our Malteses, our little fluffy guys, they can have what's called a retained baby tooth. And we always look at their teeth every time they come in to make sure everything's coming out okay. But with them having smaller mouths, sometimes they get what's called, again, a retained baby tooth. And just kind of use my fingers, I guess. They have the, baby tooth that's there, and as that baby tooth is, about to fall out, sometimes the adult tooth, instead of pushing that baby tooth and going right in the same spot, will push right next to that baby tooth, and then there's two teeth in one section. And we strongly recommend getting those teeth extracted, because having that baby tooth there that's eventually going to die can cause an infection and just bacteria to build up. And we don't want to put them under anesthesia too many times, so we try to do two things at once. And if we do see those retained baby teeth, we do recommend getting those baby teeth pulled at that time while they're already under anesthesia. So that's something we definitely look at every time they come in for vaccines. So if we do recommend that or mention that, that's what we're talking about. I do also have some questions sometimes about collars, and do they have to wear that collar after the procedure, which I know is really a pain. And they do have some great, fabric collars or the donut collars. They have, I believe, like little onesies that you can put on them now. The reason that we go with the plastic e-collar is because it's proven the most effective as far as keeping your baby from getting to that incision. So sometimes, with the donut collar, they can still get around that collar and still get to their incision and lick it and gets irritated. And that's when, we have to do antibiotics in the middle of their recovery process, which we really, don't want to do if we don't have to. And sometimes too with the fabric collars, they don't prevent them from licking as well. And the plastic collar, even though it looks awful and I know it's torturous, I went through it with my cat and my dog, and I, wanted to take it off and save them. But they don't understand why we have it on and what they're not supposed to do. So we have to really be strong, and they can eat with the collar on. They can do everything as normal with the collar on. It's just odd because they have these plastic pieces that are hanging out around their head. So it is weird for them, but they can function with it. And, I know a lot of people feel guilty and then they take it off and then they can't get it back on because the dog has learned, well, now I got it off. So, I don't want it back on. So, you just have to stay strong and keep that collar on. Like, just can't stress that enough, because we just want the recovery and the healing process to go really smooth, so there's no hiccups, down the road. But as far as the spay and neuter, that's really it that I have to talk about. I hope I answered all of your questions as far as, everything that comes with the spay and neuter, and, why we recommend it. Again, we recommend it just to prolong the life of your baby and to keep them healthy. So by doing those spay and neuters between that 6 to 9 month time frame is super important, to just get that taken care of, so we can just reduce the risk for any hiccups, later on in life. So we just strongly recommend that, and kind of what we do to prevent and make a smooth procedure, you know, when that time comes as far as doing the pre-anesthetic blood work. But if you have any questions or concerns, again, my name is Gabby. I'm one of the vet assistants. So you can reach out to me, any staff member at All Creatures, and we can gladly go over any questions, concerns you may have, or to get you scheduled. If your baby is in that 6 to 9 month range and you haven't planned, you know, the time of the neuter, I highly recommend looking at that schedule. You know, and we can get something set on the books for you so we can get your baby taken care of and have that all done so you don't have to worry about that after you get it done. But I hope everybody has a great weekend. And please, you know, I love to hear feedback on these videos. I'm always trying to do the best with the information I can give, and I really hope that you guys find this helpful. So please reach out to us or leave a review to let me know how you enjoy these videos, because I just want to know that you guys are enjoying it as much as I'm enjoying making these videos from home. So I hope you guys have a great weekend. Bye.